Hi, folks. I'm Kevin Chaikin with MP Group, an independent Medicare insurance agency focused on making sure that you transition to retirement with peace of mind and have a great Medicare experience throughout. Today, we're going to be covering Medicare basics. So if you're watching this, you're probably turning 65 or getting ready to retire, and you may have an appointment with us already. We'd love for you to be educated about Medicare for when the time comes that we have this conversation so we can help you narrow down your choices and prepare properly for your transition to Medicare. So let's jump right into it about the Medicare basics here. Let's talk first about Medicare eligibility. Eligibility is pretty simple. You either need to be a United States citizen or a legal resident. If you are a legal resident, you must live in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. In addition, you must meet one of the following requirements. Either be age 65 or older, younger than 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or Lou Gehrig's disease, ALS. Now, the parts of Medicare is the fun part, the alphabet soup, as we call it, because we have all sorts of letters, and sometimes these letters repeat even when we get into Medigap conversation. So we'll try to simplify this as much as possible for you. But the four main parts of Medicare are A, B, C, and D. Part A is your hospital coverage, and on your card it will say hospital Part A. This is more of an inpatient care, so inpatient hospitalization, rehab, or a nursing home, some home health, and hospice will be also covered under Part A. Most of you will pay $0 per month for Part A because you've paid into this program through your taxes over your career. For those that did not qualify based on having enough credits, it's 40 credits or 10 years of work, the same amount that qualifies you for Social Security benefits. You may have to pay a premium for Part A, but again, most will pay zero. By the way, you can also claim that off your spouse if you yourself did not have the work credits. For Part B, this is your outpatient care. It will say medical Part B on your Medicare card. This is more of your day-to-day medical services. So your doctor's visits, your therapies, your imaging, labs, preventive services, all your outpatient care under Part B. Now, most everyone is going to pay the Medicare Part B premium unless you qualify for Medicaid. That may be subsidized for you, but most people will pay the base rate. In 2024, that base rate is $174.70 per month. For those that Medicare consider a higher income earner, you may be subject to IRMA, or the income-related monthly adjustment amount, which we'll cover a little bit more in detail later on. In addition, on Part B, by the way, you also can have late enrollment penalties for enrolling late. If you don't have other coverage, we'll cover exactly how to avoid those penalties, but the penalties do apply to Part B. Part C is Medicare Advantage. These are all-in-one plans that will combine your Medicare A and B, along with typically prescription cover under Part D, all in one plan. Now, this is provided by a private insurance company. So what happens here is the government is contracting out your Medicare, and the insurance company is now providing all of your benefits that the government would have otherwise provided to you under original Medicare. And you'll use that one card for hospital, medical, prescription coverage, as well as any additional things that the plan offers that Medicare does not cover, such as dental, vision, hearing, and more. These are network-based managed care plans. So similar to what we're used to with employer coverage or individual coverage, they will be an HMO or PPO typically. That means you're best served to stay in the network when it comes to seeing your providers. You may have options to go out of network with plan designs like a PPO. So you certainly may have some more flexibility, but typically that comes at a higher cost. Now, premiums vary for these plans based on where you live and what plans are available. So if you have plans available in your area that have zero premium, the same cost for everybody on that plan. And many of these plans currently do have $0 premiums, not all, but many do. And remember, the government is contracting your Medicare to the insurance company, and they are paying that insurance company. So certainly the insurance company is collecting money. They're just able to pass along low or no additional premium to you since they're getting that money for being contracted by the government. Understand, however, if you have a $0 premium, you still have to pay your Part B premium to the government. Additionally, you will have out-of-pocket costs. Instead of paying the monthly premium to the insurance company, you'll pay co-pays and co-insurance for most medical, most inpatient and outpatient services. Now, Medicare Part D, also provided by the insurance company. So even though Medicare designs or Medicare sets the requirements for Part D, the government is not providing you drug coverage. So you will enroll in Part D through a private insurance company. If it's not included in your prescription or your Medicare Advantage plan, and you're on original Medicare, then you're going to have a standalone Part D plan. Now, there will be a premium that you pay to the insurance company for the plan. You are also subject to IRMA or the income adjustment on Part D. So if you are subject to that income adjustment, you will not only pay the premium to the insurance company, but an additional adjustment to the government. These plans do have to meet certain requirements set by Medicare, but they can vary based on the monthly premium, the formulary, the cost sharing involved in the drugs that you're taking. So it's always important that we look at your exact medications to understand really what the best plan is for you, because there is no one size fits all here by any means. Just like Part B, I mentioned it there, we have a penalty for not enrolling in Part D on time. It's not to say you have to get Parts B and D at 65, and we will cover that shortly. But if you don't navigate this properly, you can face those lifetime penalties under Part D as well. You are, again, going to add this if you're on original Medicare A and B, and you'll typically have a Medicare supplement plan as a secondary payer, and the standalone drug plan is a separate pharmacy benefit. This, again, is coverage for your self-administered outpatient prescriptions, not something that you might go to an outpatient setting to receive an infusion or injection for. Now, Medigap is that private secondary payer. So in this case, you have Parts A and B. You have to have those to get a Medigap policy. The government offering Parts A and B pays first. The Medigap policy pays second. So it's additional coverage for deductibles, copays, and coinsurance that Medicare A and B would otherwise leave you to pay. These are also offered by private insurance companies, and the benefits are standardized. So the most popular plans these days are plans G as in golf and N as in November. So if we are comparing Plan G from 5 different companies, the medical benefits are identical. It's just the difference is a matter of what you pay per month. Overall, long-term rate stability was something that we always look at, customer service, and potentially some ancillary benefits. But your medical benefits are identical from company to company when comparing the same plan letter. The premiums here are impossible to provide in a presentation like this because they vary based on where you live, what your age is, what your gender is, whether you use tobacco, and also your household size can impact your premiums, as there might be discounts depending on your living situation. Now, your plan options. We just kind of talked about this, but to go a little bit deeper, and we do have another video you can watch that goes really deep into the difference between Medicare Supplement and Medicare Advantage. But again, there are 2 options. You reach a fork in the road, you have to choose one of these options. You cannot pick the best of both worlds and combine them. So option 1 is that traditional route. You have Medicare A and B as primary. You add a Medigap or Medicare supplement policy as secondary to cover some of the costs not paid by original Medicare, and you would add your standalone Part D plan as a separate coverage. And then that's very much based on your individual prescription needs. Additionally, Medicare does not cover dental and basic vision and hearing, so you can self-insure those things, or we can help provide you individual policies that would help to cover dental, vision, and hearing needs. The benefits on option 1 are a couple things. 1, Medicare has no networks, no referrals required, and very minimal use of prior authorization. And even though you're paying additional premium for your supplement, you're going to have much more predictable and typically lower out-of-pocket costs going this route. On option 2, Medicare Advantage, you're going to enroll in A and B still, and then have your Medicare Advantage plan become your primary and only payer. That means everything, including Parts A and B benefits, prescription benefits, are all billed through that plan. You will typically have some additional benefits like the dental, vision, and hearing options perhaps, and you're going to use that same card for all of those services. In this case, you will have less predictable out-of-pocket costs because you're paying a copay or coinsurance based on your utilization of the plan. They are also network-based, so while you still and oftentimes will have plenty of options for providers, it is going to be more limited than going on original Medicare. Now, there's not a right or wrong way to go for every single person. Everybody is different. One thing, however, to be aware of are your rights to enroll in these plans. Medicare Advantage plans, they're going to take you, regardless of your health history, as long as you're enrolling during a valid enrollment period, then you apply and they will take you regardless of your health history. With option 1, the Medicare supplement policy, you have a 6-month open enrollment window that starts on the first day of Medicare Part B. And if you do not enroll in those first 6 months, then you may be subject to medical underwriting by the insurance company, and they can at that point decide to decline your application or charge you higher premiums. If you do apply in that first 6 months, or you apply before Part B starts, then you will be guaranteed during open enrollment to get whatever policy you want without any medical questions being asked. So it is important to understand your rights when it comes to being able to enroll in these types of plans. It's not as easy as switching back and forth whenever it's convenient for you. Speaking of enrollment periods, at 65, this is your initial enrollment period. That does not mean everyone has to enroll in Medicare at this point, but if you're going on Medicare A and or B, you would start that process 3 months prior to your 65th birth month. So for example, I'm born April 16th. When I'm 64, on January 1st, I'll be able to start my initial enrollment for those 3 months leading up to April. And if I apply during those 3 months, my Medicare will start on April 1st, not on my birthday, but on the first day of my birth month. If I apply in April or any of the 3 months following, my coverage will begin the first of the following month. Now, is your enrollment automatic? If you're receiving Social Security benefits prior to the age of 65, then yes, it is. You will be automatically enrolled into Medicare Parts A and B. If you don't want Part B at that point, you will have to decline it. So you will be on the lookout for something from the government, including a Medicare card. If you want to decline Part B, you don't want to decline Part B, you will need to respond to them. You will be automatically enrolled. For everybody else not receiving Social Security benefits prior to 65, no one's going to tell you that it's time to enroll. At least no one from the government will tell you. So you do need to be on the lookout yourself, and you will need to complete those applications yourself. We provide as much guidance to get you to the finish line as possible, but that's a step that you will need to take on your own to actually submit an application for Medicare A and B. Now, you would apply during your initial enrollment period. I recommend going online to ssa.gov. It is quick and easy, and you'll get an email confirmation. But you can also go ahead and mail or fax your application into your local Social Security office. You can call them or go in person, either by appointment or walk in to apply in person at the local office. Now, if you're working past 65, delaying Medicare Part B in particular, you will have all the time that you're still enrolled in the employer group plan to enroll in Medicare, as well as 8 months following the end of that coverage. And you will be able to do that without penalty and at any point in that 8-month window. With Part C and D, however, you only have 63 days from when your coverage ends with your employer. So if you are going on a Medicare Advantage plan, for instance, and you haven't gotten Part B yet, and you wait more than 63 days, you're not going to be able to get that Medicare Advantage plan until you have another opportunity to enroll at a later date, which will cause potential gaps in coverage and late enrollment penalties. Our goal working with you, if you're working past 65, is always to make sure that your employer coverage ends the end of 1 month and your Medicare starts the next day. Now, to determine whether or not you can delay coverage, it's really based on your employer size. So if your employer has under 20 employees, Medicare sees itself as the primary payer of claims. So you should plan to enroll in Medicare A and B at that time. And more than likely, you're going to drop off employer coverage and go on to Medicare Supplement with Part D or Medicare Advantage. You certainly could keep your employer coverage as secondary, but coordination of benefits within Medicare's program will work better with Medicare-related plans. So you do want to plan to apply for Medicare before age 65 if you're in this situation. Everybody else who's with an employer over 20 employees, Medicare is seen as your secondary payer. So in this case, you can go ahead and delay Parts B and D because you likely have creditable coverage as Medicare sees it. Typically, we recommend you would enroll in Medicare Part A when you're first eligible because there's no cost and it will act as secondary hospital coverage to your group plan. That said, if you're contributing to a health savings account and you want to continue those contributions, do not do anything with Medicare, as you cannot have HSA contributions and Medicare happen at the same time. And if you are enrolling beyond 65 and you are continuing HSA contributions, we recommend stopping those contributions 9 to 12 months before you're planning to enroll in Medicare Part A, because Medicare Part A can go back retroactively as many as 6 months earlier. So we'd like to avoid those overlaps and in turn avoid excise tax penalties and repayments. We don't typically recommend going on Part B at this time because then you're just paying for Part B as a secondary payer and you may mess up some of your enrollment options later on. So typically just Part A, but you should be able to delay Medicare Parts B and D without penalty. But it's always good to check with your employer, your benefits administrator on the group coverage to be sure it's creditable for Medicare B and D. Applying during a special enrollment period, very similar. You can do that online. I do also recommend that. It is a different application, but you'd fill that out and attach a CMS L564, which is a request for employment information. You can also mail or fax that information or visit in person. That CMS L564, something we can always provide you, is going to prove that you've had qualified coverage since you turned 65, so that you'll have no late enrollment penalties and you'll be able to enroll in Medicare any month out of the year while your special enrollment period exists. Now, those penalties, they are lifetime penalties. So on Part B, you're going to pay 10% of the current Part B premium for every year that you could have had Part B but did not enroll. So if you are not on a qualified group plan, let's say you're on an individual policy and you wait a year, you will have a 10% penalty on top of whatever the current Part B premium is at that time. And you're going to pay these penalties for the rest of your life, as long as you're enrolled in Medicare Part B. The same goes with Part D. These penalties do not go away. As long as you're on a Medicare Part D plan, you will pay a percentage, a 1% per month of the national premium average for every month that you're not enrolled in Part D. So this number is going to continually increase, likely a percentage of a larger premium as the premiums rise every year. So those penalties will typically increase, and again, they will go on forever. So it's very important to understand whether you can delay Medicare and to do that properly and make sure you enroll properly when you're eligible. The premiums we already talked about for Part B in 2024, it's $174.70. If you are an individual making over $103,000 or a joint filer making over $206,000, you may be subject to the income-related monthly adjustment amount. Please keep in mind they are going to look back 2 years at your tax returns. So even though you've retired, they're looking back 2 years. It's not to say that you have to live with that determination. You can appeal it, but you won't know what they're going to charge you really until you apply for Part B. And at that point, you would appeal it. Obviously, you may already believe or know this, but we would certainly help you with that as part of our service. We don't want to leave you out there to figure it out on your own. But you can see those premiums get pretty high for the highest income earners. Not only do they charge you more on Part B, but you will also pay a Part D surcharge. That is in addition to whatever you're paying your insurance company for Part D. So if you have a $50 drug plan, you will pay that to ABC Insurance Company. And then if you fall in that category of $33.30 per month on Part D, the government's also going to charge you that $33.30. So it does seem at times like you're paying 2 premiums for Part D. Unfortunately, that is how it works. So if you've got IRMA on Part B, it's coming for Part D as well. So some helpful resources: Social Security Administration website, Medicare website, CMS. There's an app online you can use for your smartphone, which tells you what's covered, and of course our website. And you can also talk to a local agent or a local Social Security Administration representative. So that's it for Medicare Basics. Please watch the additional videos to get more about Medicare. And we look forward to talking to you during our appointment and making sure we can go deeper into your particular situation. Thanks so much for watching.